Good morning, everyone. I'm Marcia Hovey. I'm the Executive Director of Cadre, and I want to welcome you today to our presentation on the power of faith in disasters. We have so many faith-based organizations in Santa Clara County and around the nation, and sometimes we don't give them the credit that they are due for all of the things that they do every day to keep the community going. And then particularly in disasters, we have a number of organizations that really step up and do amazing work. So we want to share both of those with you today. And this is our commercial to let you know that there is a My Shake app. It's an app that lets you know that the ground is going to shake before it shakes, if it's a 4.5 earthquake or higher. So we encourage everyone to download that free app. It was developed by UC Berkeley and is adopted by the California Office of Emergency Services. And it's just a great little app. It gives you a few seconds of warning to up to a minute, depending on how far you are from the epicenter. Doesn't seem like a lot of time, but it does give you the opportunity to get off a ladder or step away from a window and just not be caught by surprise. In addition to that, we have recordings and resources on earthquake safety in your home, and those are also available on our website, and Lynn is going to put that up now. We have this information translated into, the recording is in at least 10 languages, I lose count, and we're hoping to add more languages so that everyone in the community has access to earthquake safety information. We also have information on air quality, which if we have a wildfire or if it's just a bad air quality day, it's good to know. And instead of having to Google air quality, you can just click on our link here and see pretty much all of the reliable resources on what to do to protect yourself, or how to actually check the air quality to see if you need to cancel any activities for the day. There's also information on schools. We have how to make a do-it-yourself air filter that you can put in your house. It costs about $50 to buy a box fan and the HEPA filter in order to do that, but it will reduce the impact of the air quality in your house. And speaking of wildfire, we also have a webpage on wildfire safety, and that is translated into 2, 3, 4, 5, 6, 7, 8 languages. And there's written material as well, and I hope that you take advantage of those. They're all free. And for today's session on the power of faith in the community, we're going to provide an overview of the disaster response in Santa Clara County and discuss the Faith Support Network, learn about capabilities of local and national partners in disaster recovery, identify opportunities to collaborate, provide resources for planning and coordination, get your feedback, and talk about what the next steps are. First of all, in Santa Clara County and in most counties in the state of California, and not as much in other states, but there is this concept called Voluntary Organizations Active in Disaster, or VOAD. At the national level, there are organizations that are partners at the national level, particularly a lot of faith-based organizations are members of National VOAD, and they deploy to all of the states when they're requested, and they deploy internationally. And then within each county that has a VOAD, we coordinate our local resources that are not part of government, so that we can come alongside government and provide support as needed for the things that government doesn't necessarily have the resources or the understanding of the local community to provide directly. We do want to partner because we do have a lot of resources in Santa Clara County, and we want to make sure that we use them to the best of our ability, so that in a disaster, we're not having to go to the outside for help as much as possible. So we have a Northern California VOAD and a Southern California VOAD, and we regularly meet and talk about challenges to disaster coordination. We are then connected at all of the levels of the standardized emergency management system. That's what SEMS is. At the field level, so the first responders, we don't work directly with first responders, but we do work at the local government level and at the county level. And we do have a counterpart at the state. There's a voluntary agency liaison at the state. There's also one at FEMA. And when we have a coordination call after disaster, they're all on the call so that we can hear about all of the non-governmental resources that will be made available. But all disasters are local, so all of our planning starts here. We work very closely with our government partners. Actually, most of the cadre staff was at some point emergency managers in Santa Clara County or in the vicinity. So we have a lot of expertise in speaking both the non-governmental side and the government side of disasters. Our mission is to support the disaster response and recovery efforts of nonprofit, faith-based government and private organizations in Santa Clara County through collaborative partnerships, documentation, and education. The 4 C's of VOAD are communication, coordination, collaboration, and cooperation. We don't provide, cadre does not provide direct services. We support everyone that might be providing direct services. We have a series of support networks. These are a few of them that are under development. One for organizations that work directly with access and functional needs or are looking for information, reliable information about that. Disaster case management is part of long-term recovery. Donations, and that's the in-kind, the things that people give, and our main leads on that are the Goodwill and the Salvation Army. Food sourcing and distribution, which we have hundreds of organizations, including faith-based organizations that provide food. And then mental health and spiritual care and immigrant support, and there are others, but this is because our county is very big and we have a lot of resources. We're now starting to narrow down the focus to each different support network so that we'll start to have coordination meetings that are with people that have similar functions and similar interests so that we can get more specific information to the networks that will benefit them and their coordination during disasters. Now, for faith community, there are some existing networks that I'm aware of. There's the South County Interreligious Council, there's the Silicon Valley Interreligious Council. Cupertino, I hear, had a council prior to COVID, but it may not have come back all the way. And we're working with Cupertino right now, the city of Cupertino, to bring all of their faith community back together. And so these organizations, okay, Liz, so these organizations on a day-to-day basis communicate with their members, and they can also do that post-disaster. They can do communication and coordination. I'm curious for those on the call if they were part of any one of these organizations during COVID and how that worked. Did you get your questions answered in a timely manner? Were you able to find reliable information? I know it was a very, very challenging time, particularly for the faith community when you weren't able to meet in person. Would anyone like to share how they got their information during COVID, where they got it?
The Jewish community was able to have every single temple that I know, Jewish synagogue or temple in Santa Clara County, was able to do things virtually and had Zoom or WebEx or Teams. And they in fact worked with, and many of the members of their congregations were in, such as myself, with Red Cross and Cadre, and that's how we would do things. I do not know. We've had a rabbi change during that time, and I'm not sure exactly what our particular synagogue congregation Shir Hadash did, but I do know that we worked with other organizations and we worked with WebEx and virtual.
Thanks. And that's great. I mean, that was quite a change for everyone during COVID, but it did allow us to stay connected to the community. And we can continue to do that, assuming that our internet is going to stay up after the disaster. And since we are in Silicon Valley, I'm hoping that the Silicon Valley companies don't plan on having the internet go down.
By the way, Marcia, I live in the Villages, and we have the Villages Jewish community, and we were able to continue with services and prayer and things because we had our own Zoom contract.
That's great. Yeah, so what Cadre wants to do is identify all of the existing networks and then work with the networks to see if they want to take on the disaster coordination part of this, so that Cadre doesn't have the obligation of talking to every single faith organization, but we can have some intermediaries that can pass information along. And if there are questions, during COVID, we had sometimes daily, sometimes weekly, depending on, the stage we were in the event, we did coordination calls on Zoom again. And if we had to do it in person, we could do it in person, barring any infectious diseases. But we had those meetings. We had the public health and local government share what they were doing. We had the nonprofits and the faith community share what they were doing. And then if there were questions that weren't getting answered, then Cadre would follow up and then create a frequently asked questions list so that everyone would have good information and got all of their questions answered, because it was very difficult for individuals to get answers, individual organizations, from public health, and unless you were already connected to a network. So also during COVID, we did have an emotional spiritual care group that met periodically just to share ideas on how to stay connected. And we also created a mental health directory of services during that time too. Anyone else want to share?
Hi, I'm Leslie.
There's Leslie. Hi.
Hi, yeah. I have a couple different experiences. Hi, I'm Leslie Meehan. I can answer wearing my Silicon Valley Interreligious Council hat. During COVID, our main connection with information was being part of a public health kind of listserv where they were trying to share information about vaccination availability. And so we were able to push that out to our affiliates and networks. So that was a great way to stay connected. So we had the experience of feeling connected in that way. At the same time, I also happened to be the moderator of one of the Christian churches that I belong to. And we were scrambling to try to figure out how to decide whether to have hybrid services or in person, and what the guidelines were and so we spent a lot of time and effort researching statistics on both the Santa Cruz side and the Santa Clara side, and trying to make the best decisions about, was it safe to meet virtually or in person or not. And that was very stressful. It would have, and hard work. I would have appreciated having a place to go to figure that out together.
Well, we always try better the next time.
Yeah, I hadn't kind of put two and two together until this call about what could we have done differently? What could we do differently next time for that particular situation?
Mm-hmm. Yeah, and so it is good to, and each of us are getting information from different sources. So when we come together, we end up learning a lot more than we do individually. So
Right.
it really was helpful, just to connect with other people that were having similar challenges.
Mhm.
Anyone else want to
And
share?
The
Oh, go-
minister, actually, she was part of a network of other clergy, and their experiences were very helpful. I wasn't in those meetings, but now I'm remembering that she had a lot of useful information that came from that network. So that's again reinforcing that the connections are really important.
Yeah. So, um, so I'm happy that, and I do know that some of those they were created for COVID, and whether or not they continued, maybe it's not a bad idea to continue them if it was something that where people had already established a network, but we want to make sure that everyone has access to a network. And so we will be connected to each network that already exists, and individual organizations can join those networks and join the Interfaith Support Network for Cadre. And we have to decide on how that's going to look for us. So the purpose of ours is to have that forum for collaboration, and it could be before disaster if the group wants to do that, or it can just be during disaster. We're developing for each of the support networks that we have a communication website where you'll be able to share resources. And instead of getting a million emails, it's a place where things will be posted. You will have a password protected area to share what you're doing, and that Cadre will share with you. We're mapping the locations of all the churches so that we can see if there are, a synergy with several different organizations in a geographic area that might want to support each other during a disaster. For example, one building is damaged and you can't hold services, but another building will open its doors for you to hold your services there. You might want to pool resources to help just the neighborhoods around you, that kind of thing. You can share those best practices and the challenges during the disaster and prior if we want to do that. These networks will be supported by Cadre staff, and so either Cadre will call the meetings, or if there's an organization that wants to run the support network for the whole county, then we will just attend those meetings and support that organization. But one way or the other, we want to make sure that everyone has a voice in Santa Clara County at one location. And then it's going to be designed and led by the participating organization. So if you want to meet once a year just to touch base, or if you would like to have some regular discussions on different topics, we can do that. And there's our counterpart, but not really our counterpart, but there's a faith network in San Francisco that does a lot of really good work with they're meeting every month. They're doing recorded meetings, and you can get on their San Francisco Interfaith Council. They have all the recordings of the great trainings that they do as well. Any questions about this? This is just a kind of a high level overview. We're not making any decisions today, but I wanted to let you know what we're planning, because we see that communication is always the thing that's the hardest in a disaster. And so we want to set something up that we can implement, that everyone is already used to interacting with. Cadre has resources, whether you're a part of a network or not. CadreSV.org. We have a whole preparedness section. There is a faith-based organization section. So anytime we get resources that are directly targeting the faith community, we put them there. If you have resources related to disaster preparedness and you want us to put them there, just let us know. during disasters, we have a response and relief section. This is just an example of one that we had for the fire response for I think it was the SCU fire. Lots of drop down information, and again, a place for us to consolidate if we're doing memorial services for, people that have been injured or
Yes,
killed.
Tom. Yes, Tom.
You're on. Liz, is that
Tom?
you? You're not on
Yes.
mute anymore.
Yes.
Let's mute Liz. Okay. So you can see a few of the resources that we have there, and obviously this one is not kept up to date because that fire was 4 years ago now. But we do leave some of the information up and available because it's just regular good preparedness. And then when the disaster happens, we can add new information without starting from scratch. You'll see here, because this was a fire, there was information that you could pass on to the congregations on how to properly wear an N95 mask, because you can't just put it on if there are spaces in on the sides of the mask and air is getting in, then you're not really protecting yourself. And then we also have this trusted information sources that you can reference. We have every city and every first responder organization, whatever their websites and their social media contacts are, so that you could look there for information as well. But it's always, will have everything that Cadre knows about the disaster will be posted here so that you have access to it, whether you're part of Cadre or not. This is an example of the map where we've already started mapping the food community. And so this is obviously it's going to be a big map for, and there will be a layer for each of the support functions. So we're already looking at the food, at where food is being distributed and where there might be a shortage of food being distributed. And just as I was looking at this, I saw where there are some intersections already between the faith community and the food distribution in a disaster, where you might have a commercial kitchen, you might have the ability to do a food distribution, or maybe you already do. Maybe you could deliver meals if we had an overwhelming need for people that can't get out of their houses. But you can just see that there are a lot of intersections between the support networks that, as we develop them and hear more specifically about what you all do, that will give us the ability to talk among our staff and share what each is doing and find those places where we can maximize the use of resources and really make sure that we're getting the best support possible to our communities in a disaster. Nobody's raising their hands, so I'm going to keep going.
Marcia, I'd like to just add, this is Francie.
Hi, Francie.
Sorry, I didn't sign in. I'd just like to add that I see the faith-based communities really having an important role in disaster is the faiths that have special dietary restrictions or needs, because when we have a mass shelter or something, it may be hard for the Red Cross to meet some of those needs, and we will need the faith-based community first help us identify when there's people in the shelter that need something, and to work with the Red Cross and Cadre to get this special food to them at the right time and the right place, so that they can have one less thing to worry about during the disaster. And those are the kind of things that I'd like to see set up ahead of time, with connections to the different faith-based groups.
Yeah, thank you, Francie, for bringing that up. And I know you've been working on that, trying to identify different organizations that could prepare food in a disaster that is vegan, that is halal, that is
Kosher.
culturally specific. So that's something that it's too hard to coordinate if we haven't talked about it in advance. But if we talk about it in advance, then it's easy to plug everybody into the system. So that, yeah, thanks for that's a great add.
Yeah, one of the interesting things that we're working on, it's not just food related, but one of our volunteers in the Muslim community, we have found that there's several things in the in Islam that would cause people to be uncomfortable in a public shelter, several requirements, and that we're working with that community. Those apparently those requirements can be waived in a disaster, and we want to arrange to have that happen and let the public know that it's okay to come in the shelter because you don't have to meet these restrictions during this disaster, according to Imam, whatever his name is. And I'm trying to reach the Jewish community also, Liz, to see if there's similar things in the with the traditional Jews. I don't know how many there are in Santa Clara County, but if there's anything that we can do in advance to identify things that would make people reluctant to come to a shelter or uncomfortable, we want to address them now with the faith-based communities. So, and Leslie, I'd like to talk to you. I don't know if there's other communities that in your group that might have something that we could do in advance to make sure that their population would be more comfortable and happy in a disaster or get their needs meet while they're in the shelter. So maybe we could talk later.
And that's why we have these webinars, because there are connections always to be made. And Francie is one of our team members. She is responsible for community relations and does a lot of work with immigrant communities and is just an amazing asset to us. And so
I'm going to put my contact information in now.
okay, thanks. I can get my screen to advance. There we go. And just other resources just to think about. The faith community has a lot of resources that that government may not have. They may have people that could help serve food. They may have buses. They may have forklifts. They may have spaces that could be shelters or storage space. I mean, there's so many things that could be, and it's not that at this moment in blue skies, we don't have needs, but in the disaster, we don't know where the disaster is going to happen. We don't know what resources are impacted, but if we think about this ahead of time and talk about what that would look like for any specific organization, then we can identify any challenges, any legal requirements or anything that we would need to do ahead of time so that you could do what you want to do. Because this is one thing that always happens after disasters, is that the community rises up to support their neighbors. And that's a great thing. But the community can be more effective if we have a plan ahead of the disaster to do that. For example, if a faith organization decided that they were going to stand up a shelter in the middle of the disaster because a lot of their neighbors were having problems and their building was still safe. And so they let everybody come in and started to house them and feed them in a shelter. Well, if you haven't coordinated that shelter with the local government that you're in, then you're going to have a problem because they may not have the resources to be able to support you. So when you run out of food or run out of water and then you call and say, hey, we've got all these people at a shelter, can you send us some supplies? They may say, no, we don't have any supplies because you weren't part of our plan. So always be connected to the network before you make those kind of decisions, unless you're positive you have the resources to keep it going without anybody else's help.
Marcia, I'd like to talk about what we would like at Red Cross.
Sure.
Red Cross ends up doing many of the shelters, and it really is very, very helpful if we could have a shelter assessment of your faith-based physical plant so that we could talk about what could be done if you were to run a shelter. We could talk about access and functional needs. We could talk about what your kitchen, and if you in fact do become part of our group of shelters in Red Cross, we will then be able to resupply you with food. We'll work with what we have, and we'll work with the community. We'll also work with you to get cots and appropriate access and functional needs cots. We'll talk about other equipment and other things. So it is really helpful not to be handing out business cards in the middle of a disaster. We really want you to reach out to us now because, knock on wood, it's quiet here. I don't like to say that too loud.
Yeah.
Because if you take a look at your hills by your homes and your businesses and in your churches, there's a lot of green grass that's starting to turn brown, and that means fire. I'd like to make one other plea. In the American Red Cross, we have different groups within Red Cross, such as health services, disability, mental health, but we also have a spiritual care group, and we are always looking for religious leaders, religious participants to be part of our spiritual care group. We were silly until Katrina. Katrina taught us a very valuable lesson. Number one, it taught us that we should in fact have a disability integration group. And it also taught us that we needed a faith-based group. Somehow there was some silly belief before Katrina that we would not be part of the faith-based group because somebody thought that everybody in religious groups was going out to proselytize and convert. And that is the silliest things I've ever heard in my 78 years of living. In the middle of a disaster, we're all working together. And we would really love to have some of your people who are certified as your religious leaders to be part of our spiritual care group. And certainly if you contacted Marcia, she can get to me, or you can get to me. I'll put my cell phone and I will put my email. I do disability integration and disaster health services, but I'm on the board, the leadership board for Red Cross here, so I can help you. And as I said, we are always looking for that because, you know, we were started in 1991, but it took many years for us to mature. So we're reaching out to you because we could use your resources and you would like to help. We would like to help you. Thank you, Marcia.
Thanks, Liz. And Cadre's office is in the Red Cross building on North.
Yes, it is.
So we work very closely together, and we work together to help get resources to the Red Cross during sheltering. We have been in discussions with the Red Cross about having this support network be double duty, so that the emotional spiritual care that the Red Cross uses when there are smaller events, when, you know, a single family home or an apartment complex gets impacted, or, you know, there's a mass shooting, then those are the smaller events that Red Cross would need emotional and spiritual care support to step up. And then during a disaster, obviously the needs might be bigger and more challenging. And so the goal is that we're not making a bunch of more meetings for everybody, but, you know, those that want to be more involved on a day-to-day basis will definitely connect you so that you can be reached to do that. And I'll stop talking about that right now because I'm going away.
Excuse me, I want to respond to Francie Collins' direct message. Disaster spiritual care is definitely alive and well. It has not been removed. It definitely is part of the client care network.
Yep, for sure.
That's good to know, because yeah.
I don't know what Jim was saying, but we definitely are alive and well.
Oh, that's so good to hear. I want to mention one more reason that it might be nice for faith-based organizations to contact the Red Cross ahead of time. And it's because if you even think there might be a whiff of chance of opening a shelter for your people or your neighborhood, you really want to learn in advance some of the pitfalls of opening a shelter, how to set it up, how to just do it from an orderly way instead of just opening your doors and letting everybody rush in a panic. Because once you've got a mess on your hands, it's very difficult to rearrange people or, make a separate area for people that aren't feeling well or for babies or, I mean, there's a method that the Red Cross has perfected over the years. And I think one of the ways that people could access it in the most simple manner is just to take the shelter management course, which is free, and anybody can sign up for that if you want to. You'd have to take a Red Cross intro course or something just to know what we do. And then after that, the next thing, if you had more interest, you could get there through Liz or, or Cadre, um, to talk to the shelter manager, because one of the things we do is after after everybody's kind of got tucked into a shelter after an emergency, things start to shift and evolve, and it becomes uncomfortable sometimes for the faith-based groups, or if you have a children's program or a school. I mean, you just have a lot of people there that are doing whatever they're doing, and you may not have the volunteers or the resources to handle them. And so the Red Cross goes around and kind of like folds a lot of the shelters into the Red Cross main shelter and helps people to move or transition. Also, to make sure you get all the information that's coming out from the government on resources and things, so that your group isn't isolated and left out of the process that's going on outside. So it's just really good to have a connection to the Red Cross if you're going to thinking of doing any kind of mass care after a disaster. Just see how to do it and then make your own choices.
Yeah, and that's what this is all about, is just helping you find where you're going to connect, or if you're going to connect, because no one has to help. So the support network. To be part of the support network, you can sign a Cadre partner agreement, which just says essentially that you're going to collaborate with us and collaborate with each other. If we have the interfaith councils part of this, then you wouldn't need necessarily a Cadre partner agreement. You could just be part of that interfaith council. So we as a network can decide on that more. And at the very least, you want to be connected so that you're part of the communication network. If you don't do anything else but share information with your congregations, that's a huge benefit to your congregations in a disaster. And it's a huge help for local government that's trying to get information out, but we don't use all of the same pathways to get information out. And how, not everyone is looking at a local government website or local government social media. So we want to make sure that people are getting information in the way that they're used to getting it, and that they trust the person that's sharing. So to be part of that communication network, which also allows you to be a subject matter expert of something, if we're trying to verify information about something that you know about, and then also that we can help get information for you if you're trying to make decisions and you don't have enough information. Also, long-term recovery after the disaster, after all of the fires are put out, after everything is rebuilt, there are still people that will need to have long-term recovery in order to get their lives back together. And some faith communities will be part of that as well. And you're going to hear about some of them in just a second. So I'm going to move on. But again, just inform your congregations on how they can be involved. You may have people that want to coordinate emergency preparedness for your congregation. So it doesn't have to be the leadership. It can be any group of people, and we'll work with them. We can provide, subject matter expertise and help guide people to be more prepared. And so this is just, you want to be able to tell people how to plug in to help during a disaster or before. And I'm mentioning donations here because this is one thing that I've seen happen too many times. And there are a couple of videos on our website on the preparedness page that talk about the disaster within a disaster. When people that mean well bring all of their used goods and drop them off at a shelter or at a any place where if there's one bag, there'll be two bags and there'll be three bags. And somebody has to go through all that and sort it and find out what's usable and what's not and what size it is. We don't even know if we need this stuff. And so it turns out it takes a lot of people to organize it. And then much of it isn't usable for this particular event. And so then it needs to be either thrown away, which is a horrible PR nightmare, or donated to some place where it could be used. So there are better strategies for getting donations. I know the congregations that have collected money and given that to a local organization to support the local community. Our Silicon Valley Community Foundation is part of a network of community foundations that have an emergency fund now, and any money that goes into that fund will be put directly back into the community to the organizations that are helping. And that could include you. So just word of caution, if you've ever talked to anybody that did this disaster donations thing, it's not fun. And it takes way more time than it's worth. But we do have other strategies and happy to talk to you about those. All right. John, are you still there? John Little. I'm going to introduce John Little. He is from Mennonite Disaster Service, and he is going to talk to us for a few minutes about the power of the Mennonite Disaster Service response to disasters.
Okay, my name is John Little, and I'm currently the vice chair for MDS in Northern California, and will become the project coordinator for the Santa Cruz project. The quick background on MDS, I understand they started in Kansas in the early 1950s, and as an outgrowth of some church members who realized that people were hurting from hurricanes and tornadoes, and they decided to do something about it, and it's grown on from there. It's MDS has divided into 4 different regions across the United States and Canada. And there's last year, I should mention that in the 60s, I had read that if a disaster had occurred and the Red Cross showed up and the Mennonites weren't there yet, the Red Cross would call the MDS and say, "Where the heck are you guys?" So early relationships were started between MDS and the Red Cross, and MDS partners with many other faith-based organizations, as well as governmental and NGOs. Mainly, the main purpose of MDS is to build homes. That's the main goal of MDS, and they operate on, or we operate on four pillars. The first would be funding. Money needs to be provided. That's not something that MDS does, although they will help from time to time, but the majority of funding has to come from the community, the state, or the federal government. But MDS provides the free labor to build the house. So funding is the first pillar. The second funding are volunteers. We need people to do stuff. MDS has a website that people can access and find out different project opportunities throughout the country. And MDS.org is the website address. And in last year, there were over 7,200 volunteers nationwide, and they repaired 95 homes. They had 402 repairs, 274 cleanups, and they also built 7 new bridges. The third pillar would be accommodations. There needs to be some place for volunteers to stay, because some of these come from New York, or they could come from Florida or Ohio or Iowa, or Winnipeg, Canada, which they have, and so they need some place to stay, and MDS is organized such that wherever they get accommodations, there's generally 2 cooks, an office manager, and a project director that runs the day-to-day projects. And generally the project director, the cooks, and the crew chiefs volunteer for 4 to 6 weeks at a time. But there's thousands of weekly volunteers, and they could just have to be there for 6, 7 days, and they can stay longer if they want, but they have to commit to at least a week. So then the fourth pillar is meaningful work. And that simply means that the volunteers that show up, let's say from Pennsylvania, they want to pound nails, they want to cut wood, they want to build a house, they want to do stuff. And so washing a car or mowing a lawn is not considered meaningful work. So those are the 4 pillars, and again, MDS has worked with and established relationships with Catholic Charities, Red Cross, UMCOR, and many other organizations, many other faith-based organizations. And Marcia, if you can think of some particular question that I need to answer, let me know.
Yeah, so when you were talking about the funding that's needed, the funding is local funding to build the houses, correct?
It could be local funding, it could be state, or could be federal, or could be private.
Okay, but MDS doesn't fund the houses, they bring the labor to build the houses.
And it's one of the things that's important, very important for MDS working is with the case managers that are established by the or hired by the long-term recovery group, because the case managers are the day-to-day interface with MDS and the homeowner. And a lot of questions can get answered and addressed with the case managers. And so the case managers are an important component of a successful rebuild in the community.
And now talk about the housing then. So where are your volunteers housed and how are they fed?
That's a great question, and it's different in every location. And in Paradise, for example, it took a year to get for the regional operations manager to find adequate housing. And the housing that, so we often have a MDS set up in a church, and it's a church that would have a kitchen and have sleeping facilities, shower facilities, that sort of thing. I should mention that in terms of the facilities, having a kitchen is real important because, and I hadn't mentioned this yet, but there are 2 cooks assigned to each that volunteer for each project, and the cooks need a kitchen, a stove and so forth, ovens, microwaves, that sort of thing, in order to cook food, because the cooks make breakfast and dinner, and they set out the lunch makings for lunch, sandwiches. The volunteers make their own sandwiches, put them in the cooler, and then take off to the job site. So that's what happens with that.
And that just made me think, so how are they transported around to the sites?
MDS has trucks and vans and the so the volunteers are transported to the project site by the project director and by crew leaders. And so they're not expected to drive to the project site.
And then how do you determine the where to build houses?
That is another great question. And MDS does not decide who gets a new house. That's a decision made by the Long-Term Recovery Committee based upon their evaluation of the needs. And what I have seen happen is that there's like a priority. You know, there's certain people that have greater needs than others. Maybe they have no financial resources. Maybe there's a person that is an invalid, confined, you know, to a wheelchair or a gurney or something, and so the case managers then go and interview these families. They evaluate their financial conditions and other resources that these families may have, and then they mix all that together, and then they say, well, you know, this family really needs help. This family needs help, but they could wait a little bit, and that sort of thing. So they go through a hierarchy of evaluation. And then MDS can refuse to build a particular house, but they don't decide what houses do get built.
Do you ever partner with other organizations that do building?
Absolutely. Yes.
Okay, like Habitat for Humanity or folks like who else does build?
We had a potential project in Placer County, I'm sorry, Nevada County, that we were going to partner with UMCOR,
Oh,
but that project didn't happen, and so that relationship didn't occur. But apparently, in the past, other connections between UMCOR and MDS have occurred. And I believe that in Planada, which is a little town 8 miles east of Merced, two organizations, I think is UMCOR and maybe Habitat, got funding, millions of dollars from either the state and or federal government. And so we're looking to partner with them. So if they want to build the basic shell of the house and the foundation and so forth, MDS could come in and we could do anything that they wanted. We could put on the roof, we could put on the sheetrock, we could do the flooring, sideboards, painting, whatever they didn't want to do, we could do that. So those talks are going on right now, and so I don't have anything to report on that, but that's just an example of how we would work, how we would work with another agency. Catholic Charities in Planada played an incredible role serving as case managers.
mhm.
And Catholic Charities was also involved in the Santa Cruz project. So,
Mhm.
so
And you're just now getting ready to start building in Santa Cruz, and it's been 3 years since the fire, right?
I understand the initial long-term care committee had formed. Steve and I had gone over there and talked to them. And then for some reason they disbanded, and then they came back together again. And then last winter of 2023, they had a lot of rain, erosion, and flooding and so forth. So their attention was pulled off of the fire victims onto these other group of victims. So that's why it's taken 3 years to finally get started in
I see.
Santa Cruz.
Okay, you mentioned some challenges when we were talking earlier in Paradise. That you were there for a long time building houses and ran out of volunteers?
Yeah, we were there for almost 3 years, a little over 2.5 years. And the four pillars that I mentioned, the funding, the volunteers, accommodations, and meaningful work, all have to be in place most of the time. If one of those pillars falls off, then maybe it's time to close that project. In Paradise, we had a lot of volunteers come from the East Coast, from cold areas. They like coming to California when it's warm,
Mm-hmm.
surprisingly. And a lot of farmers can't farm in the winter time. And so a lot of the MDS volunteers are from Amish backgrounds, and they're both older farmers and also young men in their late teens or early 20s. So they will come out, and they like to work in California during the winter. But after a couple of years, some of these groups had come out twice, and there were other project sites in California. I'm sorry, in the United States and also in Canada that they hadn't worked at, and so they said, well, let's go there instead during the summer, for example.
So somehow we're gonna have to keep their interest up.
Yeah,
Do they work 7 days a week or do they have a day off?
good question. No, they just generally work 5 days a week.
Okay,
Monday through Friday. Sometimes they can work Saturday if there's a real pressing need and something needs to happen in order for something else to happen. People could volunteer on Saturday, generally never on Sunday. And generally they have the weekends free.
okay. So if a local jurisdiction wanted to express their gratitude, they could take them to Great America or
Yeah,
something to make it enticing to come here if it gets old. It's like, well, I've already seen Santa Clara County. I want to go to a new exciting place.
yeah, that is
We'll have to sell them to get here.
so to complete the thought that you had started with your question, the reason Paradise closed wasn't because there was no more need. It was because we couldn't get enough volunteers.
Okay, well, we'll keep that in mind and see how we can make this be the most inviting place to come and volunteer.
There's the baseball field there too, isn't there? You have a huge stadium there, don't you?
Yeah, well, we have football in Santa Clara. We have Giants in San Francisco. Those are all within driving distance.
Yeah, so that could be another
There you go.
sign is maybe the long-term care committee or some volunteer would pay for a certain number of tickets or something. That would be
Yeah,
go to a free baseball game on Saturday afternoon or something like
yeah.
that.
I think that's a really important thing for us to realize that when we bring in organizations like MDS, like Suchi, like UMCOR, even the Red Cross, that they're all volunteers. And so, they're doing this not because they have to, but because they want to. And so we really do need to make sure we're taking good care of you all.
Maybe I should a couple things. One thing is that in terms of tools, people sometimes think, well, gee, do I need to bring my own hammer and that sort of thing? And the answer is no. You can, but you don't need to. MDS has tool trailers that are fully equipped with everything, and there's a lot of automatic tools like nailers and the saws and so forth. So you don't need to bring your own tool. MDS keeps a full supply of tools available in a tool trailer, and they're not afraid to go and buy another tool if something breaks or they need something that they don't already have. So that is good to know, and so you don't have to worry about bringing your own tools.
Okay, that's great. And that made me think of one more question.
Well, maybe I should also mention that MDS has shower trailers, kitchen trailers, and sleeping trailers. Now,
Mm.
most of these right now, those particular types, the sleeping and the shower trailers are back east. There's a warehouse in Missouri where hundreds of trucks and tool trailers and other kind of trailers are stored. The particular picture that is on the screen right now is from the New Hope Church in Kingsburg, California, which is about 20 miles south of Fresno. And the MDS has built a new warehouse in Kingsburg, and these trucks that you see in this picture will all be transferred over there shortly. And so we will have a training center at this warehouse. We'll have a vehicle storage, maintenance, and the tools will be refurbished if needed, or new ones purchased and that sort of thing at the warehouse in Kingsburg.
All right. That's great information. Thank you for everything that you do.
You're welcome. And I tell you a quick joke. Well, it's not a joke. It's when I was in Jennings, Louisiana, a month ago, attending a training session, and at the church where we were, that church had been the sponsor for Mennonite volunteers for the last 3.5 years.
Wow.
They had one tornado came through, and then another hurricane came through shortly after that, and so they needed a lot of help. The pastor in that church took 3 of us the next day on Saturday to the Lafayette Airport, and he was extolling the virtues of MDS, and he said, "You people are just wonderful." And I said, "Well, I don't know about that, but we are hardworking."
All right. Well, great information, and thank you for sharing it with us. And thank you for being such a good collaborator with other organizations after disaster, and for all of your hard work.
You're very welcome, Marcia. And by the way, thank you for thinking so far ahead. I tend to agree that probably the biggest worry in Santa Clara would be an earthquake.
Mm-hmm.
What do you do when when hundreds of buildings fall down and infrastructure is cut and electricity is off and that sort of thing? It takes a lot of work, and the pre-planning that you're doing right now is going to come in big time to help get things restarted.
One of the things as being part of the network is that you'll get announcements from us, and one of the things now, because we have a distribution list, an email distribution of like 700, 800 people, and not everyone cares about these 2 particular topics. And so that's another reason for the support network, is that we can send you targeted emails for things that you might find useful. And these are 2 things right now that Lynn can put in the chat. FEMA is looking for feedback on a new document that came out this month on engaging the faith-based and community-based organizations with emergency managers. They're doing some 60-minute webinars, so you might want to look at one of the webinars and get more information there. And then there's also this Urban Land Institute is doing a second workshop on doing affordable housing on faith-based property, that's a big ask, but some of you might have been thinking about that. So there is a webinar coming up later this month on, or several actually, on whether or not you would want to actually put housing on your property. And Lynn, let's see. Okay, you probably already see it. There's affordable housing on Faith Lands is already in the chat. And then the one above that is the registration for the Faith Lands workshop. Well, hold on. Where's the feedback one? Well, I maybe didn't put that one in here, but it'll be on the Cadre website in the webinar resource document that we're going to put out. Again, resources that you can access on the Cadre website at the top of the screen. It's cadresv.org. You can find events, and then down at the bottom, you'll see those events broken out. Then there's the preparedness library and the webinars. There's the response and relief section, and then a recovery section. We have a newsletter that goes out every month, and the announcements on the website is the newsletter, so you can catch up that way if you are looking for trainings or other information. And again, you don't have to be part of Cadre to do that. This is a free website. Everyone has access to it. And so just so that you can, if you want to join the newsletter, there it tells you how to do that on the website as well, so that you get them directly, or you can just come to this website and look anytime you want. Okay, now I had a couple of people that wanted to present today that couldn't be here, and so they're going to we have recorded them in advance because we wanted to make sure that you got this information. So here's the first one, and this is Tom Hill from the LDS Church.
Hi, I'm pleased to have this opportunity to talk with the Interfaith Group. I appreciate Marcia inviting me to speak with all of you. I'm the Director of Preparedness and Resiliency for the Los Altos Stake, which is a regional area for our church that's composed of 6 different wards, which are congregations in the Church of Jesus Christ of Latter-day Saints. So to begin with, I thought it'd be helpful to understand some of our preparedness principles that actually come from some of our scripture. We have a set of scripture called Doctrine and Covenants, and that's what the D&C is there, which we see as a companion piece to the Book of Mormon and the Bible. In that, our prophet has received revelation saying that if ye are prepared, ye shall not fear. So the idea is that right from a doctrinal principle, our members are asked to be self-reliant and self-sufficient to start with, rather than relying upon church leaderships or church resources and so forth to begin with. Now, later on, that may happen, of course, but right from the beginning, they're taught this and expected to be responsible for themselves. And part of this is what we call calling. So when they join the church, they are asked to actually participate in a calling or a job. And so right away, we're asking for them to participate in preparedness is one of these areas that we ask them to participate in when they join the church as a member. And then members will be in a position where they can serve neighbors in the community if they're self-reliant and prepared. It's also a CERT principle that you need to take care of yourself and your family first, and then you're able and resilient and therefore able to help your neighbors and in the community and minister. In the city of Los Altos emergency plan and other cities, most of them already declare that they wouldn't be able to get out to the local neighborhoods for at least 3 to 7 days or longer. So right from the city government perspective and first responders, if there's a major event like an earthquake, they're not going to be able to get right out to your home or to your neighborhood and really administer to people right away. Members are also asked to serve once they have these capabilities. Right now, our members have 4 families that they minister to on a non-crisis basis, what we call ministering families. So our members are used to going out, going to other families and administering their needs. They might have just something simple like a ride to work or to the airport or something, or to the hospital or doctor, but then they also help with other kinds of needs that are more necessary. Some may help out, for example, in an event like like we had a big blackout, they may come over and get some of the frozen items that somebody would have in their refrigerator that's out because they don't have power, and bring it on and put it into their refrigerator freezer if they do have power. So members are already focused around that kind of responsibility and response. Now, the church is organized into 4 different levels. It's important to understand this because this is the way our preparedness programs work. So we're in wards or congregations that have about 450 members in a geographic zone. We also have some other wards or congregations that are non-geographic, but by language groups, Spanish, Tongan, Mandarin. We have some others in Vietnamese in San Jose and so forth. A stake is a set of wards. In the Los Altos stake, we have 6 wards, but it may be more or less depending upon the stake that we have. We have 11 stakes in our area, or 12 stakes in our area here in this South Bay area, extending up to Livermore, actually. And then there's a church region that we call the North America West area. So that takes in a number of stakes, and actually California through Washington, Oregon, and Hawaii and Alaska. So each level is expected to take care of their members by matching local resources, experts, skills, and talents with the needs at that local level. So the idea is that wards should survey their own local members for their resources, as well as surveying those that have special needs. And when an event happens, they bring those 2 capabilities together, those that have a need and those that have resources, and then solve that problem on a local level. So the focus is on the local level first and then built up. If they can't do it, then they go to the stake. If the stake can't do it, they go to the area. If the areas can't do it, then they go to the church region. Now, I thought it'd be helpful if you saw and we share with you an example of the kind of training that we do. We just did this training, Ready, Set, Prep, to a set of sisters. Our female women's group had a conference this last weekend, and this is a breakout group that we did. It was focused around family. So I thought this might give you a good feeling for how we approach training our folks and kind of the resources that we expect them to develop themselves, but also where we help out from the stake and the ward level. In this particular presentation, we're focused around families, around natural disasters and emergencies. We titled it Ready, Set, Prep. So one of the key aspects of this is to have each family have grab and go bags. And this is also for their children, and even pets need these. This is an outline list of the kinds of things that should go into them. We actually have detailed lists that we handed out to the members, but we suggest they have this for a number of reasons. First of all, in our stake in this region from Santa Clara through Los Altos, it turns out that 70% of our members live in apartments, townhouses, condominiums, and so forth. Relatively few have single family homes. So they really don't have a lot of space to put together a lot of materials, plus a lot of the kinds of events that we've seen here locally in terms of power outages, floods, so forth. Windstorms have required people to move or go to another family or go into possibly even shelters if it got even worse. So the idea is if we can get a grab and go bag started, that can fit into an apartment, that gets them started working on preparedness and resiliency capabilities. So we start with that first. Then next we talk about how do you work with your children. So these are some ideas because one of the big problems with kids, of course, is giving them things to do. So this is a list of different kinds of items, balloons, colored pencils, so forth. You can see on down the list, fidget toys, etc., that our mothers have found. So, you know, the key is to tailor these contents to the age and the interests of each child, and then update it, of course, as the kids get older, their preferences and so forth change. This was a real area of interest because quite often this isn't covered in a lot of preparedness programs that focus on food, water storage, communication plans, etc. What do you do with the kids? So these are suggestions that we've developed and worked through with our team. And then finally, a communication plan. This is really crucial. Who do you call when? Who do you trust? And then practice and review this communication plan. We suggest we have something we call family home evenings once a week where the families are together and they work on a certain project or area to improve their family. And we suggest that they have maybe a little drill in here, have, a simulated earthquake, and then say, okay, who do we call? If you're at school, who do we call? What is the number? Where's there a trusted home that you could go to if you're not able to come to our home because our home isn't available, or somebody else needs to pick you up beyond grandma and grandpa? Who would that individual be on your list in your school, so forth? This is to give the kids a chance to rehearse and think about this, because uh, kids respond to earthquakes and events like this quite differently from adults. So you'll see in this next slide that we focused around emotional preparedness of children. It's quite different for them. The idea is to use, we have some pamphlets from actually Sam Hassa, the Mental Health Services federal government organization. They're quite well developed around the kinds of things that you can do as a parent to help your child through stress, but not just your child, adults and seniors as well. And these are handouts that we gave them. The idea also is to be calm. You notice the quote down here is actually from a member that was in Tennessee, had a tornado hit her home. You can see a picture of it there. And she found that the real key, even though they're obviously very upset to lose their belongings, and the kids were upset, they found that the kids picked up on their emotional response. So that after they finally were able to calm down, the kids calmed down, they got them working and distracted doing other things, toys, etc., other activities. And another thing that can be done here for emotional preparedness is to do role plays with the kids and say, well, if we, had this situation, here's how we'd handle that. You grab your grab and go bag, and here's your teddy bear, and here's some toys that you've got, and so forth. And we'd take this over to grandma's house, who's in this area, or over to the church, or wherever it might be. So they found, these mothers that developed this program, that is very important to do role plays with the kids. If you do role plays with the kids, they are then in a situation where they're prepared and they can handle the situation far more effectively. Um, so I wanted to go now to communication, which is kind of the backbone of all of this activity. And there's been a lot of requests around how we approach doing this. This relates specifically to the levels that we talked about. We have member homes, we have wards and stakes that are pictured here at the next level. Then we have Santa Clara County and city um, organizations that we work in liaison with, the City of Los Altos, Santa Clara, Sunnyvale. We also work with nonprofits, Resilience Los Altos, and in Los Altos that has BAT teams and communication systems that we've learned from using tech systems and so forth. And then finally, our area leaders in Salt Lake, and at the region level, we have 11 stake region level that we coordinate, although that's done across using Zoom meetings and ham radios and so forth. We don't have a specific office for the region. But here you can see that we suggest that our members obviously have cell phones, internet capability. We recommend for those that want to report and be engaged in an event in terms of reporting and getting information, that they get General Mobile Radio Service radios, which are walkie-talkie like radios, but they actually go a lot further than go up 1, 2, 3, or 4 miles, depending upon the wattage. And then we have ham specialists in each one of our wards and at the stake that receive this information from the members, report it to our leadership at our stake center, which is the second level there. And then we have a text-based system called WinLink that we communicate, that's the bulletin board system there, to the county. We also can receive messages from the county. Resilience Los Altos has helped us set that up, and we've tested that with them and with the county services and the city services to see if we can send and receive messages, so we know that that works in advance. And then finally, our area leaders, Northwest area leaders, want to know the status of members, status of buildings, if there's any needs where they need to bring in certain supplies and materials, and we report that up to them if it's gone beyond our ability at the stake level to handle those needs. So here are the essential points that I thought might be helpful to all of our interfaith members, faith-based organizations, that we are running this with all volunteer team. We don't have any full-time hired people, but we do have people that have certain specific expertise and resources. Ham skills, GMRS radios, there's cell with Wi-Fi. AT&T is starting to offer this in the event of certain disasters. This is voice over Wi-Fi they're starting to build in. and computers and software systems. Outpost is the software package used with the cities. WinLink is the one that we use, the text-based system, to our church leaders. The other key part in this too, quite often we get focused on the technologies. It's really important to organize your reporting, the people part of this. Who reports to who? Now, we have a structure in each ward where we have these ministering families and companionships. So we have two people, a sister and sister, a brother and brother, that have 4 families that they're responsible for. So we can immediately reach them. We know where they are. We have their emails, we have their phones and so forth. We have their addresses. In the event of disaster, we ask them to report on their families immediately so we can get a status report back. Look at how you could do that and organize yourself within your own faith-based organization. Now you want to reach out to all the various groups. Obviously, we've got Cadre here, BOAD. There are various hand groups like ARES, the Amateur Radio Emergency Services Group. These are usually by cities, by the way. CERT has some great programs by cities, and of course the county and city emergency services. So they offer a variety of different things, but they really need us to be able to pick up the situation after they've taken care of the medical needs of an individual. They really aren't equipped or emotionally set up or trained to handle the spiritual, emotional kinds of needs that individuals have through a traumatic experience. Another thing that you'll want to think about doing is to know the talents of your people. I mentioned this earlier. We have gone out and surveyed our members to know what capabilities they have, what they can do. Do they have saws? Do they have generators? Do they have 2 or 3 freezers or whatever? Do they have backup systems? Do they have backup capability and so forth for their computers that they might be able to share, so forth? You'll probably discover that many of your members have a lot of these capabilities, but you don't know what they are, so you can't match them. So it's important to do a survey of that information. And then, of course, collaborate with other nonprofit groups. And for example, Resilience Los Altos, in that area, they're starting to expand out into Mountain View, Northern Sunnyvale. There are other nonprofit groups that Cadres can put you in touch with and that you may know of that will be key groups to collaborate with. So finally, to conclude here, the goal is that we want our members to be resilient enough and take care of themselves and be prepared enough to be resilient ministers. That's what we call these preparedness ministers. So the first step is to train them on preparedness so they can take care of themselves and their family, food, water, family communication plan, and so forth, the grab and go bags that we talked about. Develop their resilience themselves, make sure that they have attended their financial situation, their emotional, psychological, and spiritual needs, because they all change, right? At certain points, they may be more resilient than at other points. And then finally, take the next step and invite them and work with them and be organized so that they can go out and do the ministering work to others. So it's basically preparedness plus resilience plus service equals resilient ministers. So that's our focus now, is on developing resilient ministers. We have people at all different kinds of levels. Some are already out there doing this kind of work. Others are still learning about how to do this. If you want more information about this, please contact me. Here's my email address, th4270@gmail.com. Thanks.
I love technology. So you can see that Tom has put a lot of thought into this, and that the LDS Church has a communication network that brings hundreds and thousands of people together. And then when they do reach out to their headquarters, they can actually mobilize semi trucks full of supplies to come into the area. And that's part of the reason it's great that they can do that. We want to make sure that Cadre is aware that that's happening, so that we can make sure that local government is aware that it's happening, so that we're not duplicating trying to find those same kind of resources for an area. Okay, I'm going to go through this real quick because the United Methodist Church Core program was not going to be here, but I just wanted you to see that there are thousands of people already organized and mobilized. So this, in Northern California, 370 churches, and then more churches, and everywhere else. They have a global humanitarian aid agency. They've been responding for years to disasters all over the world. now everyone is learning more about wildfires. We didn't have as many of those in the past, but now everyone is learning about how to respond to wildfires. And they participate at the local assistance center phase, which is right after the disaster, when local government and nonprofits will come together to find out what people need and help them replace documents and get gift cards and other things. They also help with survivors and the early response teams. And part of that emotional spiritual care is giving people a place to just talk and share their story, because that's part of your recovery, is talking about what happened to you, doing the intake and registration. They hand out gift cards and cleaning supplies and wildfire tools and hygiene kits, personal protective equipment, that's PPE. And then they work to follow up with survivors. And these are some of the fires that they've already supported, which is a whole different type of disaster response than when earthquakes happen and things are just knocked over. They do the short-term recovery, like that was just mentioned, and then also long-term recovery. They also organize donations, but it's not just asking the public. They get them in a more coordinated way. They participate in the LTRG, which is the long-term recovery group. That's what Cadre is forming a committee that will be an ongoing committee to be ready to stand up a long-term recovery group and help people. UMCOR also can fund unmet needs, which is a big part of the long-term recovery group, is that there are services that are provided by government, and then there are gift cards and things, but then there are needs that can't be covered by any of the existing processes. And so organizations will donate money, they'll donate to help rebuild a house, and that all those funds go directly to the individuals as well. And they do help to rebuild. So if people don't have insurance and they can't rebuild their house, then organizations like UMCOR come in and can do that. Just more of the types of services provided. You can see fire is now becoming one of the most popular disasters to respond to. And obviously you can get involved in UMCOR's disaster response, but you can also get involved locally with the Red Cross or Cadre, your community emergency response team. That's what CERT is. There's training available and other ways to be involved, and obviously Cadre can help you plug into any and all of that. And Steve Elliott is our contact here. And Minjing, it's your turn now. So Minjing is the Deputy Executive Director of the Tzu Chi Foundation, and he is going to talk about another massive group of individuals that help internationally.
Hey, can you hear me?
I can.
That's good. Yeah, I don't have PowerPoint this time, but I think I can go through what we have been doing. Let's see. Okay, thank you. Yeah, good to see a lot of friends, Francie, Liz, Dr. Diaz, all these good friends. Good to see you all. So Tzu Chi is an international charity organization. The global international headquarters is in Taiwan, established in 1966. Here in the United States, we have been here in the United States for 35 years. Locally in Santa Clara County, this is our 31st year already. And Tzu Chi, again, has been involved with a lot of major disasters ever since Hurricane Katrina, Hurricane Sandy, and the recent years, quite a few wildfires in recent years, and the flood that happened locally recently. So what Tzu Chi usually did is, when disaster happened, we joined the LAC operation. Thanks to a lot of a good support from local county and state and even FEMA. They always inform and invite us to join the LAC operation. What we do in the LAC is essentially trying to do intake to collect all the survivors' name list. And then we use that to be prepared for giving out substantial amount of financial assistance, emergency financial assistance. I don't want to call it just a gift because it's pretty substantial. And after so many years of experience, as Marsha said, materials, clothes, donations, really very, very difficult to manage. And we found that the best thing to help the survivors right away is to provide them money, financial assistance, so that they can use that for whatever the most important need for them right after the disaster. And so when disaster happen, but for that we have to, we want to be really make sure that we provide the substantial amount of financial service to financial assistance to the real survivors, to the people who really need it. And therefore we have a pretty strong backend team behind the scene. After we collect the intake information, we are able to work with a lot of agencies to make sure we have the right people. And then in a very short amount of time, after we evaluate, after we make assessment and management make decision, we are able to mobilize a lot of volunteers to hand those debit cards, the financial assistance, directly to the survivors one-on-one. And use that an opportunity not only to provide the financial assistance, but also use that a good opportunity to interact with the survivors, to comfort them, to provide them a very good opportunity to talk about their feeling. So I think that's a very good combination of providing some kind of emotional support and the financial support. So that's our main way of helping the survivors after the disaster. And in the recent years, we start to participate as much long-term recovery support as possible, especially in the case management area. Even though most of our people are volunteers, they don't really have a very, very, they don't have a lot of academic social worker background, but they are all very, very compassionate volunteers, full of a good spirit, good hearts, and they are very good, I would say, very good assistants to former case managers. So our volunteers work with the case management agency. Right now, we start to have more and more experienced volunteers, good at case management. But we have so many volunteers who can offer special help to very special needed cases. So that's the long-term recovery part, and we also start to see if we can participate in some of the cleanup job. We have a lot of volunteers. Depending on the time needed, we can mobilize from a few volunteers to many volunteers for a particular task. So the other thing we always provide is, now it becomes very famous. It's our blanket. We call it eco blanket because those blankets were made from recycled plastic bottles, which was manufactured in Taiwan but shipped to here. We have warehouse to stage those blankets. During disaster, we always also spread the message, the importance of protecting the environment. We try to promote the recycling, and blankets is a very good gift for them, and also a very good education for people to be mindful about the environment. So blankets, financial assistance, and recently we have a very good family safety expo. I'm grateful that a lot of people agency attend this family safety expo, April 21st. And now I think it turns out to be more than 500 individuals attend this expo. We train people on CPR and have a lot of experts talking in the panels, keynote speech. The audience, of course, the primary audience is Mandarin speaking audience. In US, in United States, we have 9 regions. The region I am serving for is the Northwest region, which covers the area all the way from Fresno above up to Seattle. This is Northwest region. And under region, we have the branch office, we have communities. The U.S. national headquarters is down in Southern California in the city of San Dimas. So I think that's a very quick overview of what we have been doing. And speaking about the special food that Francie talked about, we also, when there's a chance, what opportunity, we also cook very good vegetarian food. We prepared. We shared some of the vegetarian meals in the 2017 flood in San Jose. That was pretty good. Our volunteers like to cook good meals for, especially vegetarian meals for the survivors. What else? Let me see. Okay. Recently, actually, offline, I would love to talk to Dr. Diaz more, or Red Cross more, about our old facility in Milpitas. We move all our operations now to the San Jose new campus. That's where our safety expo held a few weeks ago. All operations from Milpitas in Milpitas have been moved to San Jose. So we are exploring the possible usage of the old Milpitas building to the benefit of the community or for disaster response. Any idea will be welcome. That's just happened recently. The other thing is we also have a medical team. We can offer a free medical service after the disaster as well. And I think that's all I want to share. Anything? Let me check Marsha's email questions.
List of questions. No, I think you answered them all. I just wanted to also highlight the fact that for that expo that you did. That was a huge outreach to get that many people there. And they had an amazing interpreter service, so that whether you were speaking English or Mandarin or Cantonese, you were able to listen through headphones and listen to real-time interpretation. So during the day, it was really interesting that some of it was presented in English and some of it was not, but I was able to follow everything, and so was everyone else. So it's a great benefit to that local community to have that opportunity to be able to come together and learn in the language that they prefer, and know that they have a good connection there with Tzu Chi. So thank you, Wenjing, for everything that you do.
Thank you. The language translation is our new try. We'll try to make it even more effective.
Yeah,
Yeah.
no, I want to learn more about it because it really nicely.
Thank you.
Okay, and this is another quick video because I want you to see that, well, two things. I'm sorry, let me go back to Minjing. What concept that even though you are a disaster relief organization and that you provide these other services, that you see that there is a way that you can roll in environmental education to it. And so not only do they have the blankets that they are distributing that are recycled bottles, they also have little tents and pots and chairs that are all made out of recycled bottles. And if you ever see them at an outreach event this summer in Santa Clara County, they have those things on display. And even at this event, at the safety event, they asked everyone to bring a container for water so that they didn't have to waste as much on bottled water and cups. And that's a pretty simple thing to do that could have a huge impact on the environment and educate people. So I think we all need to just think a little bit more broadly on how our impact is affecting the community, because you are a trusted source again. So I do applaud you for all of that. And then, so this final one is the congregation at Shaim in Palo Alto. And I just want you to hear a little bit about what they've done over the last 20 years. So don't be overwhelmed if this feels like, oh, we're not doing enough, we could do more. You don't have to do it all today. And this is just what they've done over the last 20 years. And that's building resiliency and building preparedness in their community.
So I'm James Ballin. I'm here with David Snyder, and we're with Congregation Etz Haim. And hearing these great presentations, I'm realizing the resources that you've presented, some excellent resources, and it's clear that we can there's some low-hanging fruit for us to improve our abilities here. I was thinking that we might represent an average religious organization, but unfortunately, I think maybe we're a little bit above average, because we've had an emergency preparedness committee for more than 10 years, going on 15 years, and our focus has been the basic necessities that we need for the people who come in the door here. And it's really interesting, your presentations show how, even going as far as evacuating fires in the state, how you don't just have to be local, you can be regional in this kind of work. So we have our president. Well, let's talk about emergency preparedness and recovery. Really quickly, a brief history and our current status.
Is it me or
James,
it's?
you're
Yeah, you're
breaking
kind of
up a little
breaking
bit.
up.
And
Yeah,
some
James, turn off your video.
facility operators that
James,
we-
you're breaking up.
managed to do for the past 20
Ja-
years.
Our video.
Let's see.
James, you're
My
breaking up.
connection might be weak here.
Why don't you turn
Yeah.
off
Okay.
your,
My video?
Yeah.
Yes. Okay, next slide, please. So this building was a YWCA built in 1962, and we got it. We were able to acquire it in around 2004, and we did some remodeling, including we redid the roof with a foam roof, which increases our thermal efficiency. And then more recent years, we've been able to add EV car charging in 2017. Utility solar panels in 2021. We upgraded our heating system to a modern heat pump HVAC, so we now have cooling in 2022. And we've worked with an organization called MoveView, and they're specialized in arranging for people who need a place to park overnight, a safe place to park overnight. And we've been authorized for 4 guests overnight in our parking lot. And they provide a portable bathroom and a wash station for them. And that was actually, it took the committee who focused on that took a number of months to work with the city neighbors to coordinate that, but we did get it in place. Next slide, please. Hopefully I'm not breaking up.
no, you're good.
So we have an emergency preparedness plan that's updated every few years. We have a religious school, and the classes, every class has access to an emergency backpack. Every room has a fight. We do an evacuation training. This presentation, this process, that just our regular communications every week is an exercise in a system where our congregants are connected with each other, with the organization. So it would be easy for us to add on emergency response or emergency readiness to our regular communications. And when we have a scheduled event, we have a person assigned as our first responder and point of contact. And then we're looking to, as the next step, we would look at getting a portable battery, a solar powered portable battery. Next slide. So our HVAC upgrade is, we had a natural gas, an ancient inefficient boiler. We've replaced that with a heat pump system, and now every room has a zone control. So if we had, like you were talking about, a heat event, we could bring people in and give them cool places to stay if there was such a thing. And because we have included potable hot water as part of the heat pump system, we were able to remove our last gas appliance and disconnect from the utility service. So in the case of an earthquake, we wouldn't even have to turn off the gas because we don't have gas anymore. Next slide, please. And we've added a utility-based solar system on the roof. As I prepared for this presentation, I realized that this solar panels cannot really be used in an emergency, but we do. And it was put in with a cutoff switch, and because of you don't want the utility to be energized during an emergency if the utility workers need to work on it. So I think in an emergency, our system would be disconnected from the utility until the utility could say, yes, you could turn back on. And we have no battery storage on site. Next slide, please. And here's a picture of our car charging stations. And again, we have up to 4 guests that can stay overnight. And when we these various upgrades, the solar and the car charging stations have been they've been properly coordinated with our building's electrical load capacity. I think that's the last slide.
Yeah, this is David. Let me just add to that. Again, you know, as a faith-based organization that's been around for since 2004, the building was established. The community has worked on supporting members of the congregation. And I think what James and I are learning from participating in tonight's session and the session that I attended March 6th is that there are opportunities to work with the external community. But as Marcia kind of pointed out, you have to think it through. She mentioned that, like, you can't just go and ask someone, you know, to serve as a physician if you haven't pre-qualified them. Well, in the same way, we would not be able to just throw open our doors and do something if we didn't have pre-planning for it, which we're not set up for yet, with the exception of the 4 parking spaces in the parking lot, which took some work to arrange. So we're dipping our toe in the water of working with the external community, and we're getting new ideas to help our own congregants, sort of, if you want to think of it as a nebulous block action team. Most of our congregants are located in the Palo Alto, Los Altos area, but in Mountain View, but also further out. So this has been a real learning for James and me, and we hope that you found this an interesting example of how a facility can you know, work on its environmental issues as well as its preparedness.
Before everybody leaves, I just wanted to add a couple of other ways that faith-based groups could help out in disaster, and that's with language access. Nobody's mentioned that today, but Padre's been working for a while to try to get information to different ethnic communities in Santa Clara County in their own languages. And one of the best ways to do this would be through their faith-based groups. If we were able to send a message to designated contact in a group, and they would have committed to translate that language and push it out through their own communication networks that they always use, that could reach thousands of more people with emergency information in the county.
Yes.
And I think it may happen already on a ad hoc basis, but nobody is tracking it or seeing who gets information or who doesn't. So whole communities miss out on resources and information. So that's a thing that I'd really like to talk to anybody who's interested in connecting with you on that. And also to help undocumented people, because most of the government resources will not be available to them. And if faith-based groups are of that, you know, feel called to do that, it would be really helpful to connect on that so that we can know where we can refer people that aren't going to be eligible for any other assistance, and maybe make your plans around some resources for those people, because if it's not kind of set aside and donated, it just doesn't happen. So those are a couple of things that I think are really crucial for faith-based to recognize. And thanks.
Thank you, Francie. Thank you for bringing those up. I should have brought that up earlier. The language is a huge one.
You got me for that. So
I know. That's why I don't think about it, because you're my reminder all the time. Okay. Let's shift gears for just a second, only because I think, you know, you're already helping the community. And one of the things that I just wanted to do a quick poll, because we do work a lot with organizations that support the unhoused community. There are 89 that have filled out a survey for us on the types of services that they provide. And we haven't even touched the faith community yet to find out what you're doing. And we will send this poll out again, but I want to see if I can launch this poll. I've logged in from another device. I can't launch the poll. Okay, then I'm going to ask you this question and you can put it in the chat. What do you do to support the unhoused? And you can say we don't support the unhoused, or whatever you do. Do you provide meals? Do you provide groceries? Do you provide tents or water or shelter or safe parking like you just heard about? Is there anything that you do to support the unhoused? And I'll send out a more official survey, but I just wanted everybody to realize that, you know, the unhoused in a disaster are even worse off because they're displaced from the place that they normally were staying, which is what happened during the flooding that we had in San Jose earlier this year. And so there are great needs for the shelters. There are needs for additional support in the shelters to help everyone, and particularly those that didn't have a house to begin with. And next, our upcoming meeting is in person. It's on May 14th at the Red Cross. This is a meeting to talk about disaster recovery and how organizations can fit into the framework for disaster recovery. And so if you're interested in attending that, you can go onto our website and grab the link under the events for May 14th, and you can register there. We will be sending out a survey to the faith community in the very near future to pick a time to meet again and to identify topics or concerns, and as well as work with the existing interfaith network so that we can all, you know, kind of streamline this communication mechanism and make it efficient and effective for all of you.